The thyroid gland is a butterfly-shaped gland located at the base of the neck, right about here. It's about the size of two thumbs held together in the shape of a V. Sometimes the thyroid gland can grow larger than normal. We call this condition a goiter. It may not cause any symptoms, or it may cause visible swelling in the neck, difficulty swallowing, or difficulty breathing, including coughing and hoarseness. This growth may also be a sign of cancerous cells.
Growing gland will often start to bump out nodules. For example, this enlarged goiter we call it a multinodular goiter. When there is a solitary nodule, that means a single nodule and the rest of the gland is normal in size, the incidence of thyroid cancer in that nodule is about 10%. When there is a multinodular goiter, that means that there are many nodules, probably because the gland has been growing. The incidence of malignancy in those nodules is between 2 to 3%. So our job is to decide which nodules concern us and how to approach them.
There are a number of reasons why the gland may grow or form a nodule. The most common cause of goiter worldwide is a lack of the chemical iodine in the diet.
In areas that have iodine deficiency, which they no longer have in America, those used to be called goiter belts, because iodine is such an important part of thyroid hormone, the gland will sometimes grow as it's trying to trap iodine. So in areas that are landlocked and have iodine deficiency, in Asia, for example, there can be goiter simply due to this iodine deficiency. One can make antibodies against the thyroid. It's probably the most common gland to be targeted by what we call autoantibodies. That's antibodies against our cells, and those can cause the thyroid gland to grow, and we call that Hashimoto's thyroiditis. Another is that clearly we don't know everything about the stimuli for thyroid enlargement. We know that it tends to run in families, and to see patients with people who have thyroid issues, one of our first questions we always ask is, do you have a family history of thyroid disease? Because they are so common.
Small goiters that aren't noticeable and don't cause problems usually don't need treatment, but those that affect the thyroid's hormone production or are malignant do. The first step is to conduct ultrasound imaging of the thyroid and any nodules. Ultrasound will reveal the size of any nodules, whether it's solid or cystic, and if there's any abnormal vascularity or calcifications. All of this will weigh into our decision of whether or not we need to biopsy the nodule.
If we need to biopsy the nodule, depending on the size of the nodule, we will either do it in the office without an ultrasound, or if the size is small or there's any technical issues, it will be done with ultrasound guidance. That means the patient will then have an ultrasound over the thyroid nodule to ensure the aspiration, that's the biopsy of that nodule, is going into the correct area. If the biopsy is benign, then that nodule can just be followed. If the biopsy shows any degree of irregularity, depending on the irregularity, or atypia as we call it, we may decide to follow and repeat the biopsy or send the patient to surgery. So there's a lot that is involved, but majority of nodules are benign. The other good news I do want to emphasize is, should the nodule end up being cancerous, the vast majority of the time, surgery with postoperative radioactive iodine tends to be curative.
Goiters can develop in anyone, though they're more common in people over age 50, those who have a family history, those who have been exposed to radiation, and those who lack iodine in their diet. Women are more prone to thyroid disorders in general, and so are more likely to develop goiters, especially during pregnancy and menopause. The only way to possibly prevent goiters is to make sure you consume enough iodine in your diet. Simply using iodized salt can help with that, and maybe tossing a little bit of salt over your shoulder for some good luck. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.